I know my H1C number. I know my blood pressure number. I don't have a brain health number. Is there a way to create a scale that might suggest with all the fingers elements on it and maybe some of the cardiovascular elements on it, whether we use this as a brain health scorecard for companies and their employees or with consumers directly? Is there some utility potentially in using that as a tool to get people who scored a 10 and they could be at a 20 to say, okay, well, I'm at 11. How are you? I'm at 12. Well, what did you do that I'm not doing? Is that a useful thing to think about?
Yes.
Do you want me to let me
You could try
go
it
first and frame it, and then these guys are more expert than me. But I think that we need to do this. It's an absolutely critical project to work on, but let's do it at different scales because we probably need different types of brain health scores for different scales. Let's do a global brain health score where we can use data from like the World Bank and the WHO and such and Gallup and whatever can help us. So we have a global brain health score, a national level brain health score, which of course we know that the Institute for Health Metrics and Evaluation is working on with their Brain Health Atlas. But then we need to have a company level brain health score, which Kelly is working on and you and I. And then also for individuals, that's where it gets into multi-omics, I think, about advanced biology, which my two colleagues here are more well-placed to talk about multi-omics at the individual level.
Great.
I fully agree. Of course, we should have a brain health score and having different type, not only one. And this is for me the implementation gap, how we really can start implementing the research. It normally takes 15 to 20 years, which I think is too long time. And this kind of tool and score would really help. This is also the step we can take to move to the precision medicine because we all have different risk scores and that could be a motivational and educational tool.
George, I think you've hit the nail on the head. We now live in an age where you can get information all the time about what you're doing. I now know how many steps I do each day and how many I don't do various days now. So it tells me immediately to change. And if you can do certain key things about how quickly you're doing things and brain measurement things, very simple ones, and if it changes, is that because, now we have to be careful here, it doesn't mean you're necessarily dementing. You may have slept badly. You may have not done as much exercise this week. You can see the real-time relationship between what you're doing and how your brain is functioning. Then people do make very profound changes. It's like cholesterol for heart, it's like other areas. It becomes consumer driven, not healthcare profession dependent. And you can make the changes every day. So I think in the new era of wearables with simple neuropsychological tests that are now available, yes, that's where it's going. And that also in the developing world, most people now have access to those kinds of technologies in one way or another. So the sort of massive change we're talking about at scales is no longer dependent on health professionals or high-end tech. It can be done with lower-end tech for really critical aspects of brain function that you can monitor. And as long as we're really clear that it's changing, doesn't mean you've lost it. It means you may need to look at it with you. Is it sleep? Is it exercise? Is it diet? And see how it varies, which a lot of us don't want to know, but how it varies. I drank too much last night. I was too stressed at work. I need to relax more. I need to exercise more and see the improvement in your function, just like with your physical fitness, just like with your heart rate, just like with your hemoglobin A1C. You can see the effect of lifestyle on your brain. In the past, we couldn't see that. Now we can.
Well, I'm enthused by this conversation. I really am, both about what you started and continue globally around the world, the science of how it is that we now understand different things about the plasticity or the resilience or the capacity of the brain at any point in time, and the fact that you're thinking at a global level on how to invest in this is really very impressive. So I want to thank the three of you. I want to thank this audience. Continue the effort to think about how brain health is part and parcel of your life. Ask yourself, ask every member of your family, what is the memory that you'd least like not to forget? And remember, maintaining your memory and maintaining your brain health is so critical to all aspects of life. So thank you.